You having a good time, Tommy?
Having a good time?
What people call, or even I call, tough, dark times in my life, I'm able to call them blessings in a weird way. I wanted to become a nurse because of my experience as a patient. I'm gonna be on the floor. I was once a patient. Like, how cool could that be? I was born with a hypoplastic left heart syndrome, which is just like a congenital heart defect. So I had my first open heart surgery when I was 8 days old, and I had 5 open heart surgeries by the time I was 5. That worked pretty good for a little while, and then my heart went into failure, and they said there was nothing else they could do for me surgically, so my only chance of survival was a transplant. On June 3rd, 2009, I was blessed with a call that they said they had a heart for me, and so I received my heart transplant on that day at 8 years old. And then I lived a pretty great life, pretty normal, I guess, normal life you could say, for about 10 years. And then in 2019, shortly after my high school graduation, I started getting these bad headaches that turned into like really bad body aches. And I found out it was like a form of post-transplant leukemia. And so then I was admitted here on the oncology unit for about 6 months of intense chemotherapy treatment. It's just recently put on the survivors list for a cancer survivor at the 5-year mark. Finding a career path that fit me for a long time, like I couldn't figure it out, which is crazy for me to say because I've been in the hospital throughout my entire life. Why else would I be anywhere else? I realized that the best way to do that was to go into the field myself and be a nurse because, just to be able to give back to other patients all the helpful and amazing lessons and things and comfort and care that I've been given here by the nurses and team here at Mott. I thought what better way to give that back than to go into that myself.
I've bonded with him since he was teeny tiny, and we've shared a lot of great memories. I never thought that we would actually work together someday. I thought by the time he graduated, I would be way too old. It's awesome. I'm so glad that I get to work with him.
They've been great coworkers, just as they have been nurses for me when I was a patient. That's the kind of nurse that I'm hoping to be. Just having that ability to uniquely connect with patients in ways that, that a textbook can't teach you in nursing school, that nobody can teach you unless you've gone through what they're going through yourself. I've loved, every second I've been working here.
I've talked to some parents who have met Tommy and had him as their tech, and they have had nothing but wonderful things to say, and they feel like it's really special to have somebody who understands where they're coming from and can relate with their children. Not everybody has those scars.
Finally able to find where I'm supposed to be makes my heart jump. It makes me smile. It, just brings me comfort, and just seeing the hope in those patient and families' eyes that I know other nurses have given me and my family is just, again, feels full circle, and it just feels, it feels like I'm right where I'm supposed to be.